Hello everyone, my name is Surya, staff nurse. So today's session we are going to discuss about multiple sclerosis. And I welcome everyone to Nurse Talk. So when we are discussing about multiple sclerosis, the topics which we are only going to cover is just a brief note about the MS and also what type of questions can be asked from the topic of multiple sclerosis for your upcoming nursing exams like the NORCET, RRB, or state examinations. So, yes, we will start about multiple sclerosis. So, this picture image shown in here is an image of neuron. So, everybody know what a neuron looks like. This is a cell body of neuron, and this is the axon, and here is a myelin sheath and the dendrites in here. The signals received are traveling from the cell body in here to the dendrites over here. Okay, here is here is the signals, the transfer of signals from the cell body to the dendrites. So in case of multiple sclerosis, or if we get a patient who is diagnosed with multiple sclerosis, what is happening to the patient is the myelin sheath of the patient in here is disturbed, or it is destroyed in the case of multiple sclerosis. See that it is damaged. So why is it damaged? In our body, in the central nervous system, the myelin sheath in here is produced by oligodendrocytes. And in peripheral nervous system, the myelin sheath is produced by Schwann cells. Okay. So what is the purpose of myelin sheath? The myelin sheath helps to move the signals faster. So it helps us for a fast reflex. Yeah, it helps the signals to travel faster, and then thereby we can have proper reflexes. So that is the purpose of myelin sheath. So myelin sheath is central nervous system is produced by oligodendrocytes, and if the oligodendrocytes is damaged and the myelin sheath is damaged, that is called multiple sclerosis. So remember, the myelin sheath in the central nervous system is damaged in multiple sclerosis, and what will happen is the patient will not be having a faster traveling of signals through their nerves, resulting in different abnormalities related to the reflexes. So this is just an introduction about multiple sclerosis and what is happening. So in case there is a question coming up like degeneration of myelin sheath is central nervous system is called, that is multiple sclerosis. Okay, because there is another disease condition called Guillain-Barré syndrome where there is a degeneration of myelin sheath in peripheral nervous system in here. So don't mix both of them. Central nervous system myelin sheath is affected in the multiple sclerosis. Okay, so once a patient got diagnosed as multiple sclerosis, what will be the, so how are we going to diagnose the patient? We can diagnose the patient by having a CSF examination or CT MRI. If we do a CSF examination for a patient, we will do a lumbar puncture, and then we will get the CSF, cerebrospinal fluid, from the patient, and in the cerebrospinal fluid there will be increased oligoclonal antibodies in the patient's CSF. Why? Because oligodendrocytes is affected in here, and increased oligoclonal antibodies will be there in a patient if they have a multiple sclerosis. And also the patient will be having elevated proteins, and this can also be diagnosed by EEG for the person. By doing a proper electroencephalogram, we can also diagnose the person with the multiple sclerosis. Other than that, if a patient is diagnosed with multiple sclerosis, what are the symptoms the patient is going to show? So we'll discuss about that now. It's called Charcot's triad. Charcot's triad is seen in disease condition of multiple sclerosis. Just remember these 3 points: nystagmus, intention tremor, and scanning speech. These are the most important clinical manifestations shown to a patient who is having multiple sclerosis. Okay, nystagmus means involuntary and rhythmic movement of the eye. See that movement of the eye to this way and this way. It is an involuntary movement of the eye. It is called nystagmus. And intention tremor. Intention tremor occur during voluntary movements. The patient is trying to get something in her hand, or patient is trying to touch somewhere, and then the tremor starts. It's only because of the voluntary movement of the patient. That is intention tremor. Then scanning speech. The speech is slow and monotonous, and the patient will be having difficulty in making a proper sentence for conversation. So in multiple sclerosis, these are the most important clinical symptoms or clinical manifestation the patient is going to show, and its name is Charcot's triad. Charcot's triad is seen in multiple sclerosis, and it comes up with nystagmus, intention tremor, and scanning speech. Other than this, the patient will also have symptoms like diplopia, that means double vision, ataxia. Ataxia means loss of the muscle tone or decrease in the muscle tone or muscular coordination, which will make the patient fall, and then vertigo. Then again, the patient will have a blurred vision. Okay, so when somebody says you about multiple sclerosis, remember in the condition multiple sclerosis, the oligodendrocytes which produce myelin sheath in the central nervous system is affected. So the patient don't have a proper myelin sheath covering their neuron, resulting in very slowly moving impulses through their neurons. And in this condition, the patient will be having the symptoms as Charcot's triad. Charcot's triad means nystagmus, intention tremor, and scanning speech. These are the main symptoms seen in patients with multiple sclerosis. So other than this, there are two important signs which can be our questionnaire, our teachers like favorite when they do the questions for the MCQs. First one is limiter sign. What is limiter sign? In limiter sign, if the person have multiple sclerosis, limiter sign can also be called Barber chain phenomena. Okay, Barber chain phenomena. So if a person who is diagnosed with multiple sclerosis is sitting on a chair, and if somebody flex their neck forward like this, they're flexing their neck forward, and that will cause an electric shock like sensation radiates towards the spine into the arm. See that like lightning coming, the image. So limiter sign is seen in multiple sclerosis, and it is also known as a Barber chair phenomena, where a person is sitting on a chair, and if somebody flex their head, and they'll be having an electric shock like symptom through their spine and to their arms, coming down to their arms. This can also be seen in cervical spondylotic myelopathy or vitamin B12 deficiency and radiation myelopathy. But most important, when we are learning about multiple sclerosis, it's very important to know that limiter sign is seen in multiple sclerosis. And other than limiter sign, there is another sign for multiple sclerosis. This is called Uthoff's phenomena. Uthoff's phenomena is it is actually the worsening of the neurological symptoms when the patient is exposed to heat. Did you get that? The patient is already having a neurological symptoms. What are the neurological symptoms the patient having when they have a multiple sclerosis? So I was saying earlier, nystagmus, intention tremor, scanning speech, diplopia, vertigo, blurred vision, ataxia. All these neurological symptoms are already present for the patient if the patient is having multiple sclerosis. But these symptoms will worse when the patient get in contact with heat. What all heat? Like humid weather, increased temperature, direct sunlight, hair dryer, even that heat temperature from the hair dryer, exercise, which will make our body more hot, and hot tubs, hot shower or bath, and fever or an infection, or hormonal fluctuations like having menopause or periods or any hormonal fluctuations like that will also increase their worse. It will make their neurological symptoms worse and will worsen their condition. This is known as Uthoff's phenomena. So limiter sign and Uthoff's phenomena are two very important signs which are seen in multiple sclerosis. Very, very important to know that. For example, a question will be coming like this, that the patient is coming to the ward and the patient has got neurological symptoms. The examiner asks the patient to sit on the chair. When the examiner flexed the patient's head, the patient was saying she or he had an electric shock-like sensation radiating towards the spine and arms. What is the diagnosis of the patient? The question looks like a huge, massive one, but the answer is very simple. It is multiple sclerosis. And also, another question about Uthoff's phenomena can be coming like this. If a patient is having neurological symptoms, the patient complains that if the patient get a warm bath or a hot shower, or if the patient go under the sun for a beach picnic, the patient is worsening with the neurological symptoms. Why is it so? It is because the patient is going through Uttov's phenomena. That means the patient is worsening their neurological symptoms because of their exposure towards any heat. Okay, hope you got an idea about multiple sclerosis. So the things to remember while we are saying about while we are talking about multiple sclerosis is a multiple sclerosis is a neurodegenerative disorder. Here's a degeneration happening in the myelin sheath of central nervous system. Degeneration of myelin sheath in the central nervous system in multiple sclerosis, and that will affect the in the transfer or travel of signal through the neurons, because the myelin sheath is affected in here and the neurons or the signals cannot move faster as it was going before. So this is happening in multiple sclerosis, and it is the cells involved in that is oligodendrocytes, because oligodendrocytes are the cells responsible for the production of myelin sheath in the central nervous system. Okay, then we were discussing about the triads, like Charcot triads in multiple sclerosis can be very, very important. So how it will come in the exam? It can be coming in the question like among the given symptoms below, which is not coming under Charcot triad. Okay, option 1 is nystagmus, option 2 is intention tremor, option 3 is scanning speech, and option 4 may be vertigo. Okay, vertigo. So if you don't know what Charcot's triad is, or if you don't know what is coming under Charcot's triad, you will not be able to answer this question. So it's very important to know that the Charcot triad consists of three. Triad is three, of course, yeah. And nystagmus, intention tremor, and scanning speech. So if an option comes as a fourth one with that, then that is an exception. It is not a Charcot triad. It is not coming under the symptoms of multiple sclerosis. So it's very important to learn by heart nystagmus, intention tremor, and scanning speech. So this is Charcot triad, and among with that, we have already mentioned some of the clinical manifestation: diplopia, ataxia, vertigo, and blood vision. Then we are moving to limiter sign and Utov sign. We have already explained it a couple of times by this time, which can also be asked in the nursing MCQ questions like what is a symptom, or this is what happening for the patient, and what is the name of this sign called, all those things. So limiter sign means when the patient's neck is flexed, the patient is going to have an electric shock like sensation towards the spine and arm. And Uttov's phenomena means the person is going to worsen their neurological symptom if the patient get exposed to the heat or hot weather. So that's it for today's session of multiple sclerosis. I hope you got an idea about this disease condition and what are questions that can be asked from this topic for your upcoming RRB or NORCET examination. If you are interested in knowing more things about the nursing, you can pop it in the comments and I will get back to you soon. And also, thank you very much for watching. Bye bye.